Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about birthmarks a baby may have. Birthmarks are areas of discolored and/or raised skin. Many babies are born with a birthmark, or a birthmark may appear a few weeks after birth. Birthmarks are made up of pigment cells or blood vessels. Most birthmarks are benign and don't require treatment. Some birthmarks may be inherited and similar to marks on other family members. Most birthmarks are not. Red birthmarks are caused by an overgrowth of blood vessels. Blue or brown birthmarks are caused by pigment cells. Many different types of skin discoloration or marks may be seen. These include salmon patches or stork bites, strawberry marks, Mongolian spots, café au lait spots, port wine stains, spider veins, and beauty marks. Salmon patches, also called stork bites, are pinkish areas usually found on the back of the neck, the forehead, the face, or the eyelids. They are caused by blood vessels in the skin. About 33% of all light-skinned babies have stork bites. Most fade by the time the baby is 18 months old. Some are permanent. When my son was born, he had a stork bite on the back of his head that faded after a few months. Strawberry marks are fairly common. About 1 in 10 babies has them. A strawberry mark is caused by dilated blood vessels in the top layers of baby's skin. They are often red or pinkish as well as being raised and spongy. They may not appear until a few weeks after birth and may continue to grow somewhat during the next 6 to 12 months. Most disappear by age 10 and leave no scar. Mongolian spots are flat, blue or gray colored marks that look like bruises. They are usually found on the back and buttocks and are seen most often in dark-skinned and Asian babies. They are caused by a high concentration of pigment cells in the skin. These spots are not a sign of disease and should fade during childhood, but they may never disappear completely. Café au lait spots are flat spots, usually tan to light brown in color. They can be found anywhere on the body and are usually permanent. There is no treatment for these spots, but if baby has more than 6 spots larger than 1/5 inch in diameter, have them checked out by the doctor. Café au lait spots may be found in conjunction with a rare neurological disorder. Port wine stains are pink to purple to red in color and usually flat. They may fade somewhat, but they are usually permanent. They may be removed by laser surgery when baby is older. If a port wine stain appears on the face, it should be checked regularly. A port wine stain on baby's forehead or eyelid may indicate Sturge-Weber syndrome, a neurological disease. It's important for you and your doctor to watch a port wine stain closely. Spider nevi are dilated blood vessels that look like a spider web. They usually fade by 1 or 2 years of age. Moles or pigmented nevi come in several colors from light brown to black. They are caused by an increase in the number of pigment cells in the skin. Moles present at birth should be watched for any change in size and color. Large moles over 3 inches wide may be removed to avoid risk of melanoma. Keep an eye on any birthmarks your child has. Call baby's doctor if a birthmark grows, changes color, gets darker or lumpier, or if it is sore or painful. Let your doctor know if your child has 6 or more café au lait spots or if you or your child has a large congenital mold. If a birthmark is close to the eye or on baby's face, your pediatrician will check it. In most instances, birthmarks are watched to see if they fade or go away on their own. Laser surgery is used in many instances to remove birthmarks and moles. Other treatments may be possible in specific cases. Discuss them with baby's doctor if you are concerned. If you'd like to read about baby, check out our book, Your Baby's First Year, Week by Week. We cover many subjects dealing with baby in a weekly format, and each week is a fairly quick read. If you want to find out more about this podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.